Hey everyone, I'm Mila. I'm a type 1 diabetic, and today I'm going to tell you as much as I can about hypoglycemia. Let's get into the video. Hypos. Well, hypoglycemia, or an episode of hypoglycemia, is also called a hypo. That's usually what I call it, and that's when your blood sugar gets too low. It can happen to anyone, but it happens more frequently to diabetics because we use insulin, and insulin can cause hypoglycemia. It's one of the risk thing, like the really long like commercials for drugs is like these are the things that may happen if you take this, including death. Hypoglycemia is one of those for insulin. And that makes sense because insulin is supposed to drop your blood sugar, but if you take too much insulin, it can drop your blood sugar too far. So normally blood sugars vary within like a normal range. And you couldn't really tell the difference, say, between like 120 and like 150 or 150 and 160. You couldn't really tell the difference there. Because those are in the normal range. That's where diabetics are like most functional, I guess I'll put it. Because when you get too far outside of the normal range, which is different for every diabetic, it can cause you to act differently and have some weird side effects. I'm going over those today about when your blood sugar gets too low. When your sugars get like sometimes your sugars can drop so low that things get dangerous, which is another reason why I'm making this video. I'm sure if you've seen my my whole like story at times, I guess, about diabetic incidents and things that have happened to me, about like severe hypoglycemia and stuff like that, you'll know that I have been in some pretty severe situations with hypoglycemia, so I'm very well aware of how dangerous these can be, as is almost every diabetic, I'm sure. So I'm getting ready to read off a list of the more common symptoms in order of like, these are like not super dangerous and two more super dangerous. And typically what will happen when your blood sugar gets too low is you'll have some symptoms from like the beginning of the list, and then if you don't treat, you'll get some symptoms from the middle of the list, and then if you don't treat even more, you'll get some symptoms from the end of the list. This isn't an exhaustive list by any means. Every body is different. You can respond differently to having a hypo. Okay. So, and then after I give you this list, I'll tell you what it means to treat a hypo, because that can like help. So keep in mind, there are like different like groups of these symptoms, and you'll move from one group to the next as your blood sugar gets lower. That's kind of the thought process. So, the list is feeling shaky, feeling nervous or anxious, sweating, chills, clamminess, being irritable or moody or impatient, being confused, having a really fast heartbeat. That one's a little scary. Feeling lightheaded or dizzy, being hungry, feeling nauseous. Again, not helpful because you need to eat during a hypo. You can like lose color in your skin. You can feel sleepy. You can feel like you are weak or you have no energy. Lethargic feelings, that kind of thing. It can be harder for you to see, and you'll have like blurry vision. You can get tingling or numbness in your lips, tongue, or cheeks. I have never experienced that. If you have, please let me know in the comments, because I'm curious about like how that feels and how low you have to get before you get there. Because it's pretty low down on the list, but I know I've never had it, thank goodness, because that would freak me out. You can get headaches from having a hypo. You can have coordination problems and clumsiness, which really isn't good, especially if you're driving or something. You can have nightmares, or you can like be woken from sleep sometimes. Or if it gets really severe, you can have seizures. I kind of talked about that in another video of mine. So I'm not going to be talking about a lot of these symptoms in depth, obviously. I just went through the list. So obviously, if you're having those symptoms, you might be having a hypo, but it could also just say, like, I don't know, I have an intention tremor and I'm a pretty anxious person. Just because my hands are shaking and I'm feeling nervous doesn't mean I'm having a hypo. It could mean that, but it also might not. So the only way to know for sure if you're having a hypo is to check your blood sugar. I've had issues before with my CGM being completely inaccurate. It's told me before that I was like so low I was about to pass out, when in reality I was at 200. I don't know why that happens, but sometimes it does. Calibration issues, whatever. Always, always, always check your blood sugar with a glucometer. They are a little bit more, like if you think you could be having a hypo or a hyper, check with a glucometer, because sometimes the CGMs just aren't super accurate. I don't know what it is about them, but sometimes they're just not. CGMs offer a lot of peace of mind, so I do suggest diabetics get them, because you can't check your blood sugar 24/7 all the time with a glucometer. You wouldn't get very much sleep that way. And that's why I really like having a CGM, is if I'm low and it's correct, it will wake me up at night. That's why I really like them. But I digress. Just carry a glucometer with you. If you're diabetic and you think you could be having a hypo, please check your sugar with one. That's important. So the reason your body has these symptoms is that it releases epinephrine, which is the fight or flight hormone. That's what can cause the shaky feeling and the rapid heartbeat and some of the other symptoms. But it also, like, wouldn't really call it, like, a crash from epinephrine would just cause you to feel sleepy and lethargic and things like that. So just something interesting to keep in mind from a biology standpoint. As your blood sugar, like, once you get low, your body starts releasing the epinephrine, obviously, and you start feeling those symptoms, right? Say you don't treat. Your blood sugar will continue to drop, probably, and as it drops, your brain won't get the sugar that it needs to function properly, which can cause the blurred vision and difficulty concentrating and those other symptoms, as well as slurred speech, numbness, drowsiness, those kinds of things. If your sugar stays too low for too long, your brain is starving for glucose, and that can lead to seizures, coma, and sometimes death in very sad circumstances. Although that's very rare, that people will just die from a hypoglycemic incident and not know it. That's not common. So treatments for hypos, you don't have to die because of a low blood sugar, and that's good. Hypos can be very scary, especially at first, because you feel horrible during them, and you feel horrible after because your body is just giving you a big dose of epinephrine, and you have to recover from that. So the method used to treat a hypo, the best way to do it is called 15 grams for 15 minutes rule, or 15-15. There's lots of different versions of the name, but the important part is the 15 grams and 15 minutes. The first 15, obviously, stands for 15 grams. You eat 15 grams of carbs, of fast-acting carbohydrates, which is basically any sort of sugar that isn't also combined with a fat. So chocolate, for example, sugar and fat combined, the fat slows down the absorption process into your body. So eat stuff like glucose tablets, which will have instructions on how many you need to eat. Gel tubes, which I've never seen. I could probably find them on Amazon, but I've never actually seen them in person before. They also will have instructions. You can have 4 ounces or half a cup of juice or a regular soda, not a diet soda. The whole point of a diet soda being diet is that there's no sugar in it. So regular soda or juice, half a cup. A tablespoon of sugar, honey, or corn syrup. Those are all different, like, really fast-acting sugars. And then hard candies, like Jolly Ranchers, those kinds of things. Jelly beans, gumdrops, those things. Look at the food label for nutrition facts to see how many of those would make 15 grams of carbs. So once you eat your 15 grams of carbs, you're on to the second 15 in the 15-15 rule. That means wait for 15 minutes. And that can be annoying to do, to have to wait that long to check your blood sugar again, or like wait to feel that you're okay again. Because if your heart's beating really fast, time moves so slow. It feels like you're just crawling, like minutes seem like hours. It's ridiculous. For me, anyway, that's a personal experience thing. But it can be really hard to wait for those 15 minutes, but it could take up to 15 minutes for that sugar to start kicking in. And if it's, so after those 15 minutes, if your sugar is still below 70, you need to eat you repeat the rule again. And if it's above 70 milligrams per deciliter, you can stop eating, eat a meal, take insulin as normal with that meal, just to make sure that, well, your endocrinologist will tell you how you should like correct for that. For me, it's take insulin as normal because I have a pump and it adjusts automatically depending on how high or low my blood sugar is. But if you're giving injections to yourself, it'll be different, probably, if you're too low still. So the reason that you use this method is that it curbs the desire to just stuff your face until you feel better, which will cause, so you're too low, right? Here's your blood sugar. It goes too low, and then if you eat until you feel better, you'll go too high, and then it can be really hard to pull that number back down into a normal range again. It can make you feel even worse, because going too high also has really bad side effects, which I'll cover in a video at some point. So use that method. It's the best way to do it. It keeps you the safest, keeps you it keeps you feeling as good as possible through a hypo. It can be a little nerve-wracking to have to wait the 15 minutes, but that'll be better than having, too high a blood sugar for who knows how long it'll take your body to get that back down. Of course, there are a few exceptions to the rule, mainly children. Young children might need less than 15 grams of carbs, so talk to an endocrinologist or a pediatrician who knows about diabetes to figure out what your child needs if you have a small child with type 1 or type 2, really, who could go hypo. If you have a lot of lows, so I have a fair amount of lows. They're not super concerning lows. It's mostly just, I'm at the mid 60s or whatever. And I usually know why. It's because I've overestimated how many carbs are in my food, because I eat at a dining hall that doesn't always have the best nutritional information about their food. That sucks. But because of that, sometimes I go a little bit too low and I can just eat a snack and I'll be fine. But if you have a lot of lows and a lot of unexplained lows, or really any unexplained lows, talk to your endocrinologist. They can help you figure out what's going on probably, and they'll be able to help you try to avoid it in the future, if it's something that they can figure out, obviously. That's all I have time for today to talk about hypos. These are for normal hypos. There are hypos. There's another kind of hypo where you can go too low so that you need help to get out of it. And again, I've talked about that before on a different video that I can link. So I'll do a different video talking about symptoms and how to get people to help you, or how to prepare others to help you in that situation, because that's really important. Thank you so much for watching. If you would like to learn more about diabetes from a patient perspective, please subscribe below. As always, I will see you all in a couple of weeks. Stay healthy. Bye.